I want to talk about the flu vaccine and the COVID booster, whether you're trying to conceive or already pregnant. I'm getting a ton of questions about this from my patients. Should they do it? Do they need to do it? And I think it's because there's a lot of confusing headlines right now and the guidance seems less clear than ever. But I want to be clear, nothing has actually changed with any of the formal guidance from major organizations like the American College of OBGYNs. My recommendation, their recommendation, is that everyone who's trying to conceive or already pregnant should get vaccinated for the flu and get their COVID booster. Both infections are much more dangerous in pregnancy. Studies have shown time and time again that pregnant people face a much higher risk of being hospitalized, needing to be admitted to the ICU, and even death compared to their non-pregnant counterparts. And I've seen this firsthand. When I was 22 weeks pregnant with my first daughter, I actually contracted influenza A. I got the flu and I was so sick. Thankfully, I recovered, but it really knocked me down and it easily could have been so much worse. Not only could I have been so much sicker, but did you know that flu during pregnancy has been shown in studies to be associated with a reduced birth weight of full-term newborns and an increased risk of late pregnancy loss beyond 13 weeks. Furthermore, women who are having respiratory symptoms in their illness have an increased risk of having a preterm birth. Not only have the vaccines been shown to be safe in pregnancy, we know they can also protect your baby because the antibodies that your body forms in response can cross the placenta and give your newborn some early protection during those first few vulnerable months when their immune system is really immature and they're not eligible for these shots. Now look, I've become really good at anticipating future comments, and I know there's going to be people in the comments saying, my friend, my sister, or I had an irregular cycle after taking the shot. So how can you say it's safe or that it doesn't cause infertility? Look, there are many things that can throw your cycle off temporarily, and definitely an immune reaction, whether it's from recovering from an illness or mounting an immune response in response to these vaccines. It can happen. It's very transient and self-limited, and it definitely doesn't mean that your fertility is negatively impacted. There are plenty of studies that have been done over the past 5 years that have failed to show any impact of the COVID vaccine on ovarian reserve or pregnancy rates. Now, here's an important tip from guidance we were giving patients earlier in the pandemic when the vaccines first became available. Avoid scheduling these shots within 3 days before or after any major fertility procedures or pregnancy-related procedures. Not because the shots aren't safe, but because some of the side effects or symptoms like fever, body aches could cloud the clinical picture right after having an egg retrieval, for example. The bottom line is, if you're trying to conceive, you think you could be pregnant in the near future, or you're already pregnant, do not skip your flu shot or COVID booster this season. Both are safe and powerful ways that you can protect yourself and your future baby.